A client with Parkinson's disease struggles to swallow thin liquids. The best initial approach for the HHA is to A. Offer ice water frequently. B. Suggest thickened liquids as instructed. C. Avoid giving fluids altogether. D. Encourage drinking faster to finish quickly. Answer: B. Clients with swallowing difficulties often require thickened liquids to reduce aspiration risk. When assisting a client who practices strict cultural fasting, the HHA should first A. Document that the client refused food. B. Report it immediately to the supervisor. C. Respect the practice while monitoring for health risks. D. Offer alternative snacks discreetly. Answer: C. Cultural practices must be respected, but health risks should be monitored and reported if necessary. A home health aide notices an unusual bruise pattern on a bedridden client's thighs. The aide's best response is A. Ask the client's family directly about it. B. Take a picture and show it to the client. C. Report the observation immediately to the nurse or supervisor. D. Ignore it unless the client complains of pain. Answer: C. Unexplained bruises may indicate abuse or medical concerns. Mandatory reporting is required. A client with late-stage dementia begins wandering toward the exit during the night. The HHA's safest action is A. Physically restrain the client. B. Redirect calmly with familiar activities. C. Lock the client in their room. D. Call 911 immediately. Answer: B. Redirection is safest. Restraints or locking increase risk and violate rights. A diabetic client insists on eating candy before meals despite medical advice. The HHA should A. Remove all candy from the home. B. Respect the choice but report non-compliance. C. Replace candy with sugar-free alternatives secretly. D. Refuse to serve any meal if candy is eaten. Answer: B. Client autonomy must be respected, but health concerns should be reported to the care team. A client with COPD asks to sleep flat without oxygen. The HHA should A. Allow it since it's the client's right. B. Elevate the head of bed slightly and notify the nurse. C. Disconnect the oxygen to promote independence. D. Move the oxygen tank to another room. Answer: B. Oxygen and head elevation are critical for COPD safety. Refusal must be reported. During perineal care for a female client, the HHA should cleanse A. Back to front to save time. B. Front to back to prevent infection. C. Circular motions only. D. Only with dry wipes. Answer: B. Cleaning front to back reduces risk of urinary tract infections. A client suddenly reports new chest pain during light exercise. The HHA should A. Encourage the client to keep moving slowly. B. Offer water and wait 15 minutes. C. Stop activity and call the nurse immediately. D. Rub the chest firmly to relieve pain. Answer: C. Chest pain may signal a cardiac emergency and requires immediate reporting. A client with Alzheimer's refuses a shower every morning. The best HHA approach is A. Forcefully assist to complete hygiene. B. Offer the shower later or suggest alternatives. C. Document refusal and do nothing. D. Call the family to insist on bathing. Answer: B. Flexibility and alternatives improve cooperation while respecting dignity. Gloves should be removed. A. By pulling from the fingers outward. B. Without touching the contaminated outside surface. C. After washing hands with gloves still on. D. Only after leaving the client's home. Answer B. Proper glove removal prevents contamination. A client asks the aide to witness the signing of a will. The correct action is A. Agree and sign immediately. B. Politely refuse and inform the supervisor. C. Call the family to approve. D. Sign but note it in documentation. Answer B. Legal witnessing is outside HHA scope and may create liability. A client with hearing aids says voices sound muffled. The aide's first step is A. Replace the hearing aid with a new one. B. Check if the device is switched on and batteries are charged. C. Increase TV volume as a quick fix. D. Report the concern without checking. Answer B. Simple checks should be performed before escalation. When documenting, the aide should A. Record observations and personal opinions. B. Use exact words and factual details only. C. Wait until the end of the week to write notes. D. Use medical abbreviations without knowing their meaning. Answer B. Documentation must be objective and timely. A client has strict fluid restrictions. When thirsty, they beg for water. The aide should A. Offer a full glass to prevent dehydration. B. Offer ice chips if permitted. C. Ignore the request. D. Tell the client to wait until the nurse arrives. Answer B. Ice chips can provide comfort without exceeding limits, if allowed. A terminally ill client expresses fear of dying. The aide should A. Change the subject to distract. B. Listen and provide emotional comfort. C. Tell the client not to worry. D. Avoid the conversation to prevent sadness. Answer B. Active listening provides emotional support during end-of-life care. A client's daughter insists on giving herbal remedies not prescribed by the doctor. The aide should A. Allow it since family knows best. B. Report it to the supervisor immediately. C. Mix it with prescribed medication discreetly. D. Throw the remedies away secretly. Answer B. Only licensed professionals decide on medication safety. Which of the following is considered neglect? A. Forgetting to bring extra towels. B. Leaving a client wet in soiled linens for hours. C. Offering meals later than usual. D. Using gloves during perineal care. Answer B. Prolonged exposure to soiled linens constitutes neglect. A client with advanced arthritis struggles to hold utensils. The aide should A. Feed the client without asking. B. Provide adaptive utensils to encourage independence. C. Ignore the problem until family assists. D. Insist on finger foods only. Answer B. Adaptive devices promote independence and dignity. Which action ensures infection control during wound care? A. Reusing bandages if they look clean. B. Hand washing before and after glove use. C. Storing dressings in the bathroom cabinet. D. Applying ointment without gloves. Answer B. Proper hand hygiene is the most important infection control measure. When transferring a client with one weak side, the aide should A. Support on the strong side. B. Support on the weak side. C. Lift by pulling the arms. D. Allow the client to move independently only. Answer B. Supporting the weak side prevents falls and injury. A client with visual impairment asks for food placement help. The HHA should A. Describe plate items using a clock face method. B. Point silently to each food item. C. Cut all food without permission. D. Feed the client directly. Answer A. The clock method helps visually impaired clients locate food independently. During meal prep, the aide should prevent foodborne illness by A. Thawing meat on the counter overnight. B. Washing hands before handling food. C. Using the same board for vegetables and raw chicken. D. Leaving food uncovered. Answer B. Hand hygiene prevents contamination and illness. If a client begins choking but is still coughing strongly, the aide should A. Perform abdominal thrusts immediately. B. Encourage the client to keep coughing. C. Hit the client's back forcefully. D. Offer a sip of water. Answer B. Strong coughing should be encouraged. Thrusts are used only if airway is blocked. A client insists on smoking near oxygen equipment. The aide's priority is A. Allow it if the window is open. B. Remove the oxygen temporarily. C. Stop the smoking immediately and report. D. Provide a lighter for safety. Answer C. Smoking near oxygen is highly dangerous and must be stopped immediately. A confused client accuses the aide of stealing. The best response is A. Argue and prove innocence. B. Stay calm, reassure, and notify supervisor. C. Ignore the accusation completely. D. Confront family about the client's behavior. Answer B. Calm reassurance and reporting protect both client and aide. A client with a new colostomy refuses to look at it. The HHA should A. Force the client to participate in care. B. Respect feelings while encouraging gradual involvement. C. Ignore the colostomy and avoid mention. D. Call the doctor immediately. Answer B. Adjustment takes time, support and encouragement foster acceptance. Which sign should the aide report immediately? A. Mild tiredness after a walk. B. Slight swelling in ankles by evening. C. Sudden onset of slurred speech. D. Forgetting a name occasionally. Answer C. Slurred speech may indicate a stroke and requires urgent reporting. A client wants to use family recipes with high salt despite heart failure. The aide should A. Refuse to cook them. B. Cook with modifications and inform supervisor. C. Cook exactly as asked with no concern. D. Hide the salt to prevent use. Answer B. Modifications balance client preference with safety. A client has orders for daily weight monitoring. The aide should weigh the client A. At different times daily for accuracy. B. In the morning before eating, same time each day. C. Only once a week. D. After exercise for consistency. Answer B. Consistency ensures accurate monitoring for fluid changes. A client's blood sugar is extremely low, and they are conscious but shaky. The HHA should A. Give a quick sugar source like juice if permitted. B. Wait for the nurse to arrive without acting. C. Offer a full meal immediately. D. Ask the client to sleep until help comes. Answer A. Quick sugar intake corrects hypoglycemia until further care is provided.